Hello, and welcome to the Nursing Economics podcast series. This series provides extended content relating to articles published in the journal, such as author interviews and roundtable discussions. The Future of Nursing Campaign for Action is a 2010 initiative of the AARP Foundation, AARP, and the Robert Wood Johnson Foundation. The campaign seeks to ensure that everyone in America can live a healthier life, supported by a system in which nurses are essential partners in providing care and promoting health. The campaign has made progress by improving America's access to high-quality care, transforming nursing education for a better prepared profession, promoting nursing leadership, collecting data about the profession to strengthen its impact, and increasing the diversity of nursing's ranks. In partnership with AARP, Dr. Susan Hassmiller, the Senior Advisor for Nursing for Robert Wood Johnson Foundation and the 2009 recipient of the Florence Nightingale Medal, directs the Foundation's campaign for action. In this episode, Andrea Palerino, an assistant professor of nursing at Utica College in Utica, New York, talks with Dr. Hassmiller about her role with the Foundation and the campaign for action, her volunteer work with the Red Cross, and her ongoing work on behalf of nurses and patients. We are pleased to present Ms. Palerino's interview with Dr. Hassmiller.
Tell me about your career. Why did you decide to become a nurse?
I grew up in a family where my mother was a nurse. My mother graduated from New York City, Bellevue, and it's not something that she ever really told me to do. She just brought me along from time to time into the hospital before there was all the security business.
Right.
So I watched her as I was growing up with her starchy white uniform, her little hat, her polished white shoes, and then when I went into the units or the wards where she worked, I went into some of the patients' rooms and I heard firsthand the difference she was making. And you know, your mother is such a wonderful person, and she saved my life, and she's been so kind to my family, and it just seemed like an extraordinary thing to do. So it was really through exposure more than anything else that I became a nurse. And then, you know, I was a candy striper, and then I was a nurse's aide, and I began to learn firsthand what my mother was experiencing, which was the gratefulness and the gratitude that people had for you coming into their lives and taking care of them and helping them with decisions. And so it was a kind of a straight and narrow trajectory for me from being exposed to my mother, being a candy striper, being a nurse's aide, and then going into nursing itself. And fortunately, you know, nursing has so many roles to offer. I think I would have gotten bored, and I did in the beginning with but being an acute care nurse, I felt like there were other avenues for me, and so I just started testing things out, and nursing just has so much to offer, and I've never veered away from this profession for 1 second.
So why did you feel like you wanted to go ahead and get your PhD in a time where I'm sure a lot of people weren't going for that route?
Well, when I was in school, I went from a community college to a bachelor's degree, and then I felt like I wanted to work more in the community with people and populations, and the school where I was at, Florida State University, didn't have even a master's in nursing. They had a master's in education, so I went into the education department and got a master's originally in community health education and really loved that. Then soon after that, I met my husband, and we moved to Nebraska. I was a public health nurse for the state health department for a year or so, and then I decided it would be a really fabulous thing to teach. I was becoming more exposed to those who were teaching public health, and so I thought I wanted to give that a shot. And when I went into teaching, you know, I had this master's in education. You were required to have a master's in nursing, so then I went back for a master's in community health, public health education, public health nursing, and became certified as a public health nursing clinical specialist. So I was staying in education. The longer you stay in, if you want to be on any kind of a tenure track, then you do have to have a graduate degree. There was no such thing as a DNP in those days, and I'm not sure I would have taken that route. I don't know. But my thought was to stay in nursing education and teach community public health. And I came back then to live in the D.C. area, started working at George Mason, and really got the same message. If I wanted to stay in education, in teaching, then I needed to get my Ph.D. And so I decided to pursue it. And that's how I felt it was necessary to obtain a Ph.D. I was told it was necessary.
Okay. Yes. Okay. I'm going to switch gears just a little bit. I was looking at some of the social media stuff you have out there, and from your profile, your Twitter account, I could see that you're a Red Cross volunteer, and you definitely have a passion for disaster relief. How did this come? How did you come to serve as a volunteer? How did you develop this passion?
So my passion for the Red Cross really started when I was an undergraduate nursing student. I was in Tallahassee, Florida, at Florida State University, and I came home to South Florida. It was a vacation, or I was house sitting or something. My parents went away on vacation to Mexico City, and one early evening, I saw on the television set a trailer that said "Earthquake in Mexico City." And so in those days, that was in the mid-'70s, in those days there was no technology. The only technology we had was a telephone. And so I dialed 0 for help, and I talked to this operator, and I said I was really panic-stricken, and I didn't know where my parents were. They were in Mexico City, and if they were alive. And she said, well, I can't help you, but I know an organization that can. And so she clicked me over to the American Red Cross. And it was the American Red Cross that stayed with me, got my information, was able to get back with me, and I think it was like a number of hours that there were no fatalities. And in those, now you want instant messaging, and you want to know every detail of everything. But in those days, you didn't have that luxury. You had to take the information that was given to you at the time, and hearing there were no fatalities was really enough for me. And then she got back later and said my parents couldn't call out because the phones were down, the electricity was out, but the hotel where they were at was unscathed. So enough information to really get me by, and I was quite satisfied. And I came to, I was so enthralled with this organization that could help me in this way. I don't know if I'd ever heard of the Red Cross, quite honestly. But then when I went back up to school in Tallahassee, I looked it up in the phone book where they were, 924 North Gadsden Street, and I drove, before I even went to my apartment, I drove right to the chapter and told them what had happened and said, you really saved my parents, you saved my life, that's how I felt, and I want to do everything I can to give back to you. And I've been an avid and volunteer ever since, working in many, many areas of the Red Cross, including at the local, state, and for a time the national level, serving on the National Board of Governors as the chair of disaster services. And I'm now in New Jersey on the local Red Cross. I was the chair, emeritus, and now I am chair for Philanthropy Red Cross in New Jersey. And I still serve on the National Nursing Committee for the national headquarters of the Red Cross.
Wow, that's an amazing story, how you turned that into such a passion and all the difference that you've made from that one situation. That's inspiring. So my next question I have for you is that you were really instrumental in helping with the Institute of Medicine report on the future of nursing. As an RWJF employee, how has this report impacted you personally, and then how do you think it's impacted nursing profession in general?
Well, it's affected me personally because it has sort of thrown the report and me as the study director for the report and now the director of the campaign that's leading the effort to implement these recommendations into the limelight, into a position of being a spokesperson for nurses writ large, I would say nationally and internationally. And it's been quite extraordinary I'm just humbled and honored to be in this position because, as I said in the beginning, I love nursing. I grew up with nursing. It's a fantastic role for anybody, and now to be in this position of being so close and having the ability to make policies and influence policy to make things better for the nursing profession has been really gratifying. And then how has it affected the nursing profession writ large?
Mm-hmm.
I think a lot. I think that most people, nearly everybody in the nursing profession who has been to school, who teaches education, who is a leader in a healthcare system, really has used the nursing report as their Bible, as their blueprint for how they might themselves affect the profession and those nurses for whom they might have responsibilities. I know that it's becoming, or it has become, the cultural norm now, for example, that nurses go on for their baccalaureate degree. When I was growing up, it was very, very difficult. I was, as I said, I went from a community college and back to a baccalaureate degree. We're trying to make it as easy as possible for everyone, and now for the first time in the history of this country, we now have more baccalaureate nurses than associate degree nurses. So we're making quite an impact all over the place. I'm getting more nurses on boards, creating opportunities for more diverse nurses to come in and stay in the profession. So in just so many ways, the report has had an enormous impact.
In such a short period of time, too, if you think about what you have done, and that the report's not 20 years old, you know, it's amazing that all these things have been able to be done in such a short period of time. So from the report, in 2010, RWJF and AARP created the Campaign for Action to implement recommendations from the IOM report and improve the health of people 50 and older. What are some of the exciting advances that have resulted from this project?
Well, you know, I named one of them, and I have a document I'd like to send you. It's called our Campaign Success Document.
Okay.
It talks about that we have more nurses as baccalaureate graduates than ever before in the history of our profession. Nurses are coming to the, understanding how critically important it is to be a team player. We're getting more laws passed across the nation in regard to nurse practitioners, advanced practice nurses, and their ability to practice to the extent of their education and training, so full practice authority. We definitely helped influence the policy that the VA system made that says that no matter where a nurse works in any state in this country, whether the state does not have full practice authority or not, if you are working in the VA system, then you will have full practice authority. So the report provided a lot of evidence for all of the recommendations, for all 43 of the recommendations, and transition to practice. There are more nurse residencies and transition to practice programs across the country. So it really goes on, and if you're able to attach the success document to this podcast on nursing economics, that would be a good thing to do.
Absolutely. Thank you very much for that. Speaking of education, recently the Robert Wood Johnson Foundation Future Nursing Scholar Program was opened up to include all discipline. Why was this change made, and how do you think that will impact healthcare?
Okay, so just to be clear with titles, we didn't open up the Future of Nursing Scholars Program to all disciplines. Future of Nursing Scholars Program is a unique program for only nurses to come back and get their PhDs in nursing, and it would allow them to have the finances and the support and the mentoring to get in and out of a PhD program in 3 years. So that's our Future of Nursing Scholars Program. You probably are referring to our Clinical Scholars program. That program used to be just for physicians. All of our leadership programs now are interprofessional, except for the one I just described, the Future of Nursing Scholars Program. We just admitted our last cohort to that program. When everything is said and done, we will have graduated over 200 nurses with their PhDs, and we think that's extraordinarily important. It's not that we don't believe in the DNP, but PhDs are people who pay a great deal of attention to the science and the research and the innovation in nursing, and that really sets our entire profession. It's the information that sets our entire profession apart. DNPs take that research and they are translators, but we need to have a vigorous cadre of nurses who really pay attention to the core of research and the science and the innovation. So that's why the Future of Nursing Scholars Program is important. The Clinical Scholars Program was a program just for physicians. That is interprofessional now, as is, as I said, all of our leadership programs. So people should go to RWJF.org and look up the wide variety of leadership programs that we have, and there you will find opportunities for nurses to work with other professions and sectors in and amongst those programs.
Okay, thank you for that very much. So if you are a PhD student like myself, so the mission of the PhD in Nursing Science at the Graduate Center at CUNY is to improve the health of New York City residents and beyond. How would you encourage future nurse scholars like myself and others to help get involved, to eliminate health disparities and improve the culture of health?
So I think a nurse can be involved in so many different roles. First of all, you have to have this beginning understanding in basic nursing education. So we're trying to even work with schools of nursing now to encourage them to include information around how nurses can address the social determinants and how they can address issues of disparities and health equity. So I think nurses have to be, first of all, exposed to that information in school. And then both through theory and clinical. You know, it's what the nursing professors have made arrangements for in terms of, you know, say basic community health nursing clinical experiences. So it can start at the, you know, undergraduate level, theory and clinical. And then I think a nurse working in a community, I think, has more opportunities to be involved in issues of disparities, health equity, addressing the social determinants. However, that said, we should not let acute care nurses off the hook with this. They should always know the community that they're working in, where the people are coming from that they are caring for in that bed, where they are going home to. If they themselves aren't familiar with all the resources, transportation and employment and food services that a person might need when they go home, then, you know, it's up to that nurse to ensure that those resources get to that person and their family members. So no nurse should be devoid and cut off from understanding disparities in health equity and how that really results in fact, we know now that it's really those determinants that mostly keep a person healthy and well. Every nurse should take that into consideration.
My final question is, you've made so many significant contributions to nursing, including being the National Director for the Future of Nursing, co-director of the Robert Wood Johnson Foundation Future Nursing Scholar Program, and you've even received the Florence Nightingale Medal for your volunteer service. Looking back at your career, what aspect are you most proud of?
I think continuing on with my education would be one. Just having the wherewithal and the resources and the persistence and the determination and stubbornness to just keep moving with my education. I think that has been incredibly important. Getting a PhD has been an incredibly important force in my life. It allows you to play on a playing field on par with other people.
And by that, do you mean other disciplines? Is that what you mean by other people?
Disciplines like physicians and other people, whether you're in education or you're in service, or for me, I'm in policy and program. It just puts you at a different level. And then I would say certainly all of my volunteer service with the Red Cross, and I would say I would characterize the most important Red Cross service, even though I did serve at the national level and had responsibility for overseeing disaster services, I would say that my favorite and the thing that's just the most wonderful in my mind is when I'm there on a disaster, helping people with their lives as they've lost everything. So that's been more significant. And then receiving the Florence Nightingale Medal for that. And then finally the report, becoming involved. And you don't really see it in the beginning, how meaningful this could have been. But I saw it as I went on a little bit more, and then it was launched, and the importance it took on to nurses really all over the world. And so all of those things have played a significant part of my life.
If you would encourage nurses to get involved and volunteer, how would they be directed to do that? What do you think is the easiest entry for them to volunteer at a Red Cross center?
Red Cross is a wonderful organization. We always need more volunteers, but I think it depends on a person's particular passion. I was led to the Red Cross by something extraordinary and tragic that happened in my own life. Somebody could be affected by diabetes or heart disease. Their volunteer work should completely align with their passion because it's not work. They're not going to get paid for it. They need to get something else out of it. So it needs to align with what a person might believe they might get back as well as what they might give. You named the passion, and I think there's volunteer work that goes along with it. It's funny, I was online last night, and there was a website, I think it was called Do Something, and all you had to do, and they asked you like 3 or 4 questions to immediately sort of get in tune with how they might use you, and they're connected to like so many different volunteer opportunities. So there are places like that, you know, we're in the age of Google. Just put in something, and something's going to spit right back out at you, and you'll have lots of choices, I think.
Well, thank you very much for doing this podcast interview for Nursing Economics. Is there anything else that you'd like to add or clarify?
In terms of doing something and volunteering, it would be important to go to campaignforaction.org for people to look up their state, you know, Alaska, Wisconsin, Hawaii, and see what's going on in their particular state, who's the lead for their action coalition in their state. We have 50 action coalitions that we work with to implement the recommendations, and now we are working with building a culture of health and health equity in this country. So there's a lot to do with our Campaign for Action as well. Again, campaignforaction.org.
Okay. Thank you very much.
The Nursing Economics podcast series is owned and produced by Jannetti Publications, Incorporated. All rights reserved. No portion of this podcast may be used without written permission. Dr. Susan Hassmiller joined the Robert Wood Johnson Foundation in 1997 and is currently the Foundation's Senior Advisor for Nursing. In this role, she shapes and leads the Foundation's nursing strategies in an effort to create a higher quality of care in the United States for people, families, and communities. Dr. Hassmiller is the 2009 recipient of the Florence Nightingale Medal, the highest international honor given to a nurse by the International Committee of the Red Cross. Andrea Palerino is an assistant professor of nursing at Utica College in Utica, New York. For more information about the Robert Wood Johnson Foundation's The Future of Nursing Campaign for Action, visit campaignforaction.org. For archived episodes of this podcast and to learn more about nursing economics, visit the journal's website at nursingeconomics.net. You can also subscribe to the Nursing Economics podcast on iTunes, Google Play Music, Stitcher, TuneIn Radio, our hosting site Spreaker, and other various podcast delivery services.